Swadikap. Good morning. I am Dr. Chatchai Imarom. I am a Deputy Director of National Institute for Child and Family Development, Mahidol University. Today, I would like to introduce you and a nominee of the Prince Mahidol Award for this year. Today, I would like to introduce you to get to know with Dr. Gary Smith, who is a doctor in Columbus, Ohio, at the Nationwide Hospital. Dr. Gary Smith is a professor of pediatrics, emergency medicine, and epidemiology at the Ohio State University. He's a founder and the director of the Center for Injury Research and Policy of the Research Institute at Nationwide Children's Hospital. Dr. Smith is a board certified in the specialties of pediatrics and general preventive medicine, and also public health, and certified in the subspecialty of pediatric emergency medicine. In addition to his clinical training, he holds the Master of Public Health and Doctor of Public Health degrees from the Johns Hopkins University Bloomberg School of Public Health. He has been an active researcher in the field of child injury prevention for more than 35 years. He was a chairperson of the National Committee on Injury, Violence, and Poison Prevention of the American Academy of Pediatrics, and he also served on the committee for more than 10 years. He also has served as a chairperson of the Ohio chapter of the American Academy of Pediatrics for 10 years as well. From 2003 and 2006, he was a member of the initial review group for the National Center for Injury Prevention and Control of the Centers of Disease Control and Prevention. He has more than 100 injury-related articles in peer-reviewed journals. He was on the editorial board of Archives of Pediatrics and Adolescent Medicine for 6 years. And right now, he's currently on the editorial board of Pediatrics. Among above other awards, he was honored by the Ohio AAP as the Ohio Pediatrician of the Year in 2003, and by the National Section of Injury, Violence, and Poison Prevention of the AAP with the Fellow Achievement Award in 2006. Also, he was named of the first recipient of the Diamond R. McPherson Endo Chair in Injury Research in 2007. His research focuses on injuries to children and adolescents, including motor vehicle-related injuries, consumer product-related injuries, and home safety. Dr. Smith had received national and international recognition for his research and advocacy in the area of pediatric injury prevention. He combined his knowledge in pediatrics, emergency medicine, and epidemiology, and advocated preventing injuries through design changes, educating consumers and parents, and eliminating product hazards. Dr. Smith has appeared on numerous national broadcast television shows and has been quoted in newspapers and the media around the world. His work on the child safety also has a big impact on the mortality among the youth and children in the US. In 2002, the American Academy of Pediatrics released the guidelines selecting and using the most appropriate car safety seats for growing children, the guidelines for counseling parents, in which Dr. Smith was a part of the Committee on Injury and Poison Prevention. Of the data of the CDC after the release of the policy guideline found that the death among the children aged 12 and younger has been decreased by 43% between 2002 and 2011. It is undeniable that Dr. Smith has helped to save thousands of lives of the children in the US. Apart from the child passenger safety topics, with the Committee on the Injury Poison Prevention, Dr. Smith has encouraged the role of pediatricians to prevent violence among the youth by releasing the policy statement by the AAP. The policy statement points to the importance of the pediatrician's role to equip and to the relevant skills to address the violence in youth appropriately and effectively. His passions and his hard work have impacted the people in the US immensely through years of dedication. The nominee also made a successful application of the scientific knowledge to the benefits of a large number of the people of the world. Because of the Dr. Gary Smith has been working in the area for more than 35 years. He's been recognized as a main person of the work in child injury prevention. His work involves various stakeholders from the local level through the international level. Many international organizations have been in coalition with Dr. Smith, and also these organizations engage with the people around the world. Joining with the contribution of his has been widespread through through the organization and impacted children's lives across the globe. His dedication for over 35 years has reduced the numbers of injuries, either intentional and also unintentional, to the infants, children, adolescents, and young adults around the world. Dr. Smith is also on the board of the directors of the Child Injury Prevention Alliance, or CIPA, which is dedicated to the prevention of injuries to children and adolescents in the United States and around the world. CIPA achieves its goal through scientific research, translating research findings into programs and policies, providing leadership in injury initiatives and advocacy, and fostering national and global collaboration in injury research and prevention. With his position in the CIPA, he engaged in many policy-driving activities worldwide. For example, in Thailand, he supported the local community in Nan, which is the northern province of the Thailand. With his collaboration with the Child Safety Promotion and Injury Prevention Research Center in Thailand, led Nan to be certified by the WHO as the 316th World Safe Community. Apart from the safe community in Thailand, he also engaged in the area of child passenger safety, especially in car seat legislation and child boxers. In terms of child passenger safety, he is also participate in the Center for Injury Research and Policy China Affiliate Scientist Symposium in Beijing in China. Also, he is a speaker in the 4th National Injury Prevention Conference in Beijing in China as well. Apart from that, he also attended many conferences in Latin America, such as in Uruguay, in Costa Rica, or in Brazil. Dr. Gary Smith also played a big role in the child boxers in Thailand. In 2018, with the collaboration of the AAP, American Academy of Pediatrics, he endorsed the American Academy of Pediatrics to support the Thai Royal College of Pediatricians to the prohibition of the boxing among children because of the potential of physical harm, especially the brain injury. Since 2011, the Academy has endorsed this position, recognizing the boxing is a sport in which a child participant intentionally attempts to cause harm to the opponent, which is unacceptable. He has conducted a training for the trainees in Thailand and many countries around the world, and participated in the staff's exchange program in many years. So he built a strong connection around the world to make a world a better place, a safer place for children. His work across the area of child injury prevention leads to a world to be a safer place for children and save thousands of lives as well. He published over 100 journal articles, scientific articles. For example, the most 5-cited research article from Dr. Gary Smith is the incidence of pediatric traumatic brain injury and associated hospital resource utilization in the United States, or the firearm-related injuries affecting the pediatric population. He has many articles which make a big impact in the society. He has many awards and many recognition internationally. So he's one of the important person who makes a world a better and a safer place.